I'm going to share with you the three major types of gastrointestinal bleeding that bring millions of people to the hospital every year. If you know these three types of bleeds, you're going to be able to save a life of a loved one and help the medical team take care of them better. Type number one is melena. Melena is black tarry stool, jet black, just like my shirt. Melena typically indicates a bleed from the upper GI tract. When blood comes from the upper GI tract and goes down to the bottom, the hemoglobin in the blood cell breaks down due to the digestive enzymes and gets a dark color when it mixes with the stool and becomes sticky and black. This is melena. When someone has melena, we typically evaluate this with an upper endoscopy, an EGD. We go in the mouth, in the food pipe, stomach, and small intestine to see why someone has melena. We also collect the history and understand the medications to understand the risk factors for what could possibly cause melena. Is it a gastric ulcer? Is it an ulcer in the small intestine? Is there a gastric cancer? Could there be a cancer in the esophagus that's bleeding? Could there be a tear of some sort that's bleeding? Could there be a small artery arteriole that popped and is oozing or gushing blood down into the rectum? So many different causes. The GI team is the one to figure out how. Next type is called bright red blood in the rectum. This is when a patient tells you they wipe in the bottom and the toilet paper is bright red like Clifford the Big Red Dog, or they have a bowel movement and there's dripping bright red blood. This typically indicates a lower GI source of the bleeding, but there still could be many different causes for why this happens. It could be bleeding hemorrhoids. It could be an anal fissure. It could be a rectal ulcer. It could be a colorectal cancer that's bleeding. It could be a blood vessel in the colon that's bleeding. It could be something that, it could be after someone got radiation in the pelvis, the colon now bleeds easier. It could be from an infection, and the list goes on. The third type is hematochezia. Hematochezia is not black, it's not red, it's burgundy maroon in the middle, often associated with blood clots. And we see this often when we get consulted when someone, for example, has been sick on a ventilator in the ICU and suddenly they're pooping out blood clots, or someone had a traumatic event, or after a surgery, or their heart stopped, they had a heart attack 2 days later, they develop bloody stools with blood clots. There's different reasons for this: ischemic colitis, infectious colitis, IBD, various other causes. Could be a cancer, could be a bleeding vessel that oozes slowly, the blood builds up in the colon, and later when you have a bowel movement, it comes out. There's so many different reasons. The GI team assesses the situation and determines if we need to do a colonoscopy to figure out the source or the cause of the bleed. Once again, melena, bright red blood per rectum, or hematochezia. These are the three major types of bleeding that comes out the bottom and helps us figure out how to manage a patient and what type of procedures they would benefit from. Let me know if you found this valuable. Share it with your friends in the medical field so when they consult GI, they know what to say. Don't trust me, trust your gut reaction. Appreciate you for tuning in. Peace.